to you is Wangolo. I am with Endjala R, Max Hipandwa, David Miriam, and Shivute A. We are going to talk about COVID-19. COVID-19 has gone viral now, and I hope everyone has a clue about it. This video will help you to know what is really COVID-19, its signs and symptoms, how it affects people, and how one might protect him or herself. So, I am going to talk about what is really COVID-19. This is the picture of COVID-19 virus. We are just assuming these are the COVID-19 viruses. According to COVID-19 alert, it defines it as an infectious disease caused by a newly discovered coronavirus. Again, the W. Hopkins Medicine Olga CO said coronaviruses are the type of virus. There are many different kinds of viruses and some cause diseases. A newly identified coronavirus has caused a worldwide pandemic of respiratory illness called COVID-19. In addition, the Namibian Ministry of Health and Social Services described coronavirus as these are large family of viruses that cause illness ranging from the common cold to more severe diseases, such as the Middle East Respiratory Syndrome and the severe acute respiratory syndrome. A novel coronavirus was described as a new strain that has not been previously identified in humans. Coronavirus are zoonotic. Thank you very much.
Yes, COVID-19 affects different people in different ways. Most infected people develop mild to moderate illness and may recover without hospitalization. According to the World Health Organization, symptoms of coronavirus can be mild and come on gradually. I'm going to tell you the signs and symptoms of COVID-19. Signs and symptoms of coronavirus may appear 2 to 14 days after the exposure of the virus. There are less common symptoms, most common symptoms, and serious symptoms. Most common symptoms are fever, dry cough, and tiredness. Less common symptoms are aches and pain, sore throat, diarrhea, headache, conjunctivitis, loss of smell and taste, and a rash on skin. Serious symptoms are shortness of breath, chest pain or pressure, and loss of speech or movement. If you are feeling unwell or having COVID-19 related symptoms and signs, please seek medical attention as soon as possible. And always call before visiting your doctor or health facility. Next is how are we going to inform the community members about the danger of COVID-19?
So how do we plan on informing the public about the dangers of COVID-19? The first thing, which is part of our product, is videos. These videos will contain a positive message. These videos will be educational to young people because we understand that they are appealing. The second thing we have is leaflets. Leaflets, small pieces of information that is crucial to the livelihood of young people by educating themselves on the dangers of COVID-19. We then move on to books. Books with stories. The stories are about children and how they live under the circumstances of COVID-19. We don't want to forget that it's the power of the media, radio outlets, newspapers, social media. We're talking about Facebook and so forth. We'll also take advantage of posters by being able to post them around in places, making sure that people receive the information.
What are the strategies that can be used to sensitize the community about COVID-19? Since the disease can be contacted through a contact from one person to another, or from a respiratory droplet from infected person, so the only way to sustain the community about it is through social networks. This includes social medias like Facebook, Instagram, YouTube, and WhatsApp. This is you can create posters, leaflet, and also some voice notes or videos that alert the community about COVID-19, and also by using radios and TV, by giving informations on radios and TVs. You can also teach the community on how to wear mask correctly. You have to wear your mask, your nose should be in, your mouth is in, and make sure you are not touching your mouth or your nose with your hands. And after that, after you came back home, you make sure that you take off your mask, leave it somewhere outside, not inside the house, or maybe you put in a basin of soap and water, so that it can soak and bacteria can be killed. And after that, make sure that you wash your hands with soap and running water, and make sure that waters are running down, and after that they will not be used. Also, you can teach the community on how to practice social distance when they are in public place. This is, you have to make sure that when you are in public place or somewhere, make sure that there's 1 meter between you and the next person. And again, when you're greeting someone that's not that's not your housemate, make sure that you are greeting with the elbow, not like with your hands, and make sure that you wear gloves always when you're going out. And lastly, make sure that every time you are sneezing or squeezing, make sure that you use your elbow, or maybe you have a tissue that you are squeezing on, but make sure that after that, make sure you are throwing it away in a dustbin, not somewhere else. Make sure it is in a dustbin. I thank you.
I am going to answer the question which asked if there is any medication or any medication meant for COVID-19, and the answer is no. There is no vaccine or medicines meant for prevention or cure of COVID-19. Those that are affected should receive care to relieve the symptoms. People with serious illness should be hospitalized. According to the World Health Organization, it does not recommend anyone to take self-medication, including medicines like antibiotics, because antibiotics do not work against virus. They work only on bacteria infections. The most effective way to protect ourselves against the virus is putting on a mask, sanitizing, washing our hands with soap and clean running water, and keeping a 1 meter distance. So all we have to say is that we need to prevent, since prevention is better than cure.